Okay, hello everyone. Beautiful day here in a cool area here in South Florida. I want to welcome everyone out there. Just want to go ahead and be able to see my face now as we come to here. Today we have a great program and we'll be waiting for our subscribers as well as our notifications to get out all around. And today we have an interesting program. A great program. Hello, Ab. You are our first person in our chat room. Today is going to be a fun program. Today we're going to talk about the SCM muscle. Now, the SCM muscle is a muscle that will cause the majority of our problems. The good old SCM muscle. This is the muscle that that leads to lots of problems. Let's see if we can get you our. Let's see right here. Give me a second if I can get you over here. Just set this up. Hello, Melissa. Hello, Suhail. As we get the chat room moving right now, we're going to move on to our program right now. Just to let you know a little bit. I'm glad that you guys are with me here tonight. Hey, Tony. I'm sure that you can go ahead and let me know where you're tuning in from worldwide. But today we have a great program, something very different. You have not heard. Probably anywhere here on YouTube, because I'm going to go into some really interesting facts about the SCM muscle. The SCM muscle is that big, thick muscle, that band. Look what I'm grabbing right here. That's that muscle that kind of pulls us over into torticollis. That's the muscle that seems to really beat us up pretty well. But this SCM muscle is something that I'm going to talk about, and I'm going to go in a little bit of depth here. And I think you're going to enjoy this. Hello, Sabah from Saudi Arabia. Jacqueline from Nevada. Hello, Ramakandra. Puerto Rico, Pora there. And Fearless Legend and Jessica. Thank you for being here. Well, let's go into it. SCM muscle. A lot of people complaining of, chronic headaches, ear problems, tinnitus, ringing in the ears, dizziness, vertigo, chronic neck problems, contracture of the neck, difficulty turning your neck. Wow, this gets a little bit further because this affects our eyes. It affects back in the front of our forehead. It affects. Hey, hello, Melissa from Canada. Hello there, Suhail from India. It affects up in our sinuses. This is going to kind of blow you away. This is great information. We're talking about the SCM called the sternocleidomastoid muscle. This sternocleidomastoid muscle is probably the most thickest muscle, superficial thickest muscle, one of them in the body. And this here kind of grabs right onto the side of our neck here. And this is what allows us to move our head, particularly when we rotate our head, as well as flexing our head. And obviously, the scalenus muscle helps in aiding that, but the SCM muscles are key. And when you see these kind of things, it's really gonna gonna boggle you to say, "Wow, I don't believe I've been suffering with this problem all this time, and no one's picked it up." That's the problem about this particular SCM. Is that doctors don't pick these kind of things up, because if you're not having the symptoms of a true SCM problem, and you have trigger points, and we'll explain this to you, how the trigger points play a tremendous effect with different parts of the face. I'm going to show you all this. You're going to see all the pictures, and you're going to be able to have a better understanding with this. So let's go on a little bit. I just want to talk about the SCM muscle. This is a big ropey muscle. It attaches into the sternum, the manubrium right here. If you look at my hand right here, my finger, and the clavicle right next to it. Okay, you can see those are two insertions. Actually, it attaches up in the mastoid process of the temporal region, of the mastoid region, underneath, right behind the ear. If you take your finger right now and you put your thumb right behind your ear, you're going to feel a big, large bone. You'll feel on both sides. That's called your mastoid process. And that's where that SCM attaches right up into that area. So it kind of comes down. And if you look at my face here, look at my neck. When I turn my neck, you see that muscle come out. So when I turn my head to the right, you're going to see, yeah, it's a little blurry, I know, but let me go ahead and move that image. Hold on one second, guys. Okay. take a look at this image over here if it's a little easier for you. A little clearer there. But if you turn your head to the right, you'll notice on that left side here, okay, hold on, let me see if I get here. If you turn your head to the right, you'll feel the left side come out. If you turn your head to the left, you'll feel the right side come out. That's your SCM muscle. All right, now let's talk a little bit about this SCM muscle. This SCM muscle, sternocleidomastoid, first of all, these are the trigger points. I want you to look at this. Now, don't worry about reading this. I'll read this to you. But there's two actual parts of this muscle. You have the clavicular division, which goes into the clavicle, okay, into the collarbone. And you have the sternal division, which goes into the sternum region. But what this is showing you, this is showing pain patterns. This is showing you that when this particular area, in the clavicular area, look how it affects the behind the ears, inside the ear, how it affects in front of the head, in the forehead. Look how the sternal division affects all below the eyes, into the facial area. Now, this is kind of get interesting. Actually, pain on top of the head. These are all referred divisions of this SCM muscle. Those X's on there are referred pain to those red areas. And it's kind of crazy when you look at this. Let's go over to let me see if I can find this. Give me a second, guys. I got a lot of stuff here to show you, and I'm still picking on this here. All right, so those are the SCMs. Here are some other trigger points here. Look at this look at this area here. A little bit different, but similar to what I just showed you. Look how the areas, the A, the first on the left, affects all those areas in the face, behind the eyes, in the facial area, underneath the throat, on top of the head. And look how the B division, the clavicular division of that SCM, how it affects up in the forehead, into the ears. Now, I have seen so many conditions of pain in the ear, ringing in the ear, tinnitus, dizziness, vertigo, and symptoms. They've been to all different aspects on earth, to different clinics, different hospitals, and they ended up being SCM muscles. When you release those SCM muscles and you work those trigger points, these symptoms clear up. It's like magic. It's like a miracle. So I thought this was really important, that I wanted to share this with you. Now, I want you to understand something, that this SCM allows our head to go forward. When it contracts, it will contract and pull the ear down like you're watching me. It brings your head the other way. It allows you to rotate. It assists, believe it or not, in chewing and swallowing. Now, it's kind of hard to imagine this, but they do assist in chewing and swallowing. But common symptoms, when you start developing this particular problem in the SCM, and I'm going to show you, this is what we're going to get into. It's going to kind of make it a little easier that you understand this, but sleeping on your stomach, turning your head to one side. Carpenters out there, people that lay wallpaper, people that look up a lot like this, people that like to sit in the front row of a movie theater like this. People that sleep with two pillows, okay? That sleep with two pillows behind their head. I'm sorry, when they're sleeping out of alignment like this, you can see if the pillow's too high or too low, that affects the SCM. Now I'm kind of speeding the gun here. Now when that SCM contracts, it throws your head. You've seen people like this before. I don't know if you've been like this, but I see it all the time in my office. People torticollis, babies with torticollis. There are many conditions that can cause that SCM to contract. So if you look at this picture right here, this picture really shows, let me see if I can bring it down. Hold on one second, guys. See if I can make it a little smaller for you. But when you look at this picture here, come on. This picture shows the area. If you look at this, you can look at a normal area. Look at how it attaches the mastoid process back in the sternum and the clavicle. A normal view, but when that muscle contracts and it shortens, it pulls you right over. And that can be very painful. There are people that stay in this position for years, and I'm not exaggerating. There are certain conditions where the area can just stay like that for years. There's lots of ways we can break this up. There's tricks that we can do with the trade, but that's another way. Now, if you look at this, we look at whiplash, commonly seen with torticollis. How many people out there have been involved in auto accidents? That's one of the most common areas how these how these SCM muscles contract. That's all SCM muscle. When you get hit, you're resting, you get impact from behind, you hyperextend like this, you go forward. That area, those SCMs, they contract. Once they start contracting, they can cause all kinds of symptoms. So I just want you to look at that. Now, if you look at this, let's go over here. We look at the skeleton holding it. You can see when your hands are on that steering wheel and just bracing yourself, that affects the SCMs. Okay? So we stretch the SCM. Just want to throw this out at you. You can always refer back to this. This will be back on YouTube on my channel. But you can see you can stretch the SCM. For example, or the right SCM. What we'll have you do is we'll have the client left laterally flex. Then we rotate to the right, well, the head and neck. Then we extend just the lower neck and we kind of tuck it in, tuck the chin in. We flex the head. It's like this. That's how we stretch that side. You can refer back to this later. I have quite a few things I want to go ahead and show you. We showed you the trigger point. We showed you acute wry neck. That's when that SCM contracts, those muscles splint. And again, you start affecting many nerves. The trigger points here, you can see they're all affected. This is just another picture how the trigger points, when these SCMs are contracted, you get symptoms in different areas. Okay? We look at the origin here. As we talked about, the sternum, the clavicle, it inserts up in the mastoid process. We have the spinal accessory nerve, cranial nerve 11 supplying this. The movements are primarily flexion, lateral flexion, and rotation. Those are the primary movements of the SCM area. Okay? Now, look at this picture right here, guys. This looks a little blurry, okay? What I'm going to do is let me go ahead and see if I could just bring this a little smaller. I'm having a problem with my computer. It's getting me really upset, but I'm not going to show my anger with anyone here. Okay, let's make it a little smaller, but we can still see this clearer now. Now, I want you to look here. The mastoid process, and then we have, it attaches down on the clavicle. But look, it's right underneath the mastoid process. We have the external auditory canal right above where it attaches. When that thing pulls, and it's pulling, that affects the external auditory canal. It can affect the ear. People can have ear pain. It's very common. We have the greater auricular nerve. We have the external jugular vein. The point that I'm making here is that when this area is involved, you have so many other kinds of nerves, other muscles that are compromising, compensating, and you have nerves that affect back in the face, behind the eyes. A lot of tinnitus, a lot of that ringing in the ear, a lot of that ear pain, a lot of the dizziness, particularly when that thing contracts, dizziness is so common. Visual changes are so common. Now, besides that, the neck pain, the pain in the shoulder blades, you could actually get pain down into the arms. There's a lot of different symptoms you can get from this. Here is a baby, by the way, with torticollis. All right? We see this quite a bit. And these babies quite often get torticollis. You know why? Because when they're being pulled into that birth canal, they're being pulled 80, 90, 100 pounds of force, being pulled in that head out of the vagina. They get that wry neck. You stretch those muscles. And those babies sometimes can stay like this for months. I see it. They stay like that for months. So mothers, the advantage of a C-section is you won't get this. But a good doctor, needs to be careful pulling the baby out of the birth canal because there's a lot of force on that SCM. And mothers, I don't know if your kids ever had any of these kind of problems. And yes, Wesley, you can get reduced hearing from SCM contraction. I've seen it. You can get it. And the reason why I'm bringing this all out to you guys is because when you go to the ear, nose, and throat, and they say, well, your hearing is normal, everything's normal. So I'm telling you that there are ways that we can work this SCM. We can stretch it. We can put it in different positions. We can elongate it. We can go ahead and we can do myofascial work. Massage therapists or chiropractors or physical therapists can work the muscle. We can use what we call metcosonulation. We can take ultrasound with EMS and we can actually work the trigger points. There's a lot of stripping we can do. And actually, I like, when you have SCM problems, I like cross-friction massage. I don't know how many people out there know a lot about massage, but the fibers, if they run up and down, you see how the fibers are running in that SCM? They're running this way. Well, you want to massage, go diagonal, go up, just don't massage up on the muscle. Cross fiber it. When you cross fiber those muscles, you can break it down, you can stimulate it, you can release those adhesions. There are adhesions that happen in that particular area. Interesting, it's this kind of interesting stuff. It's really, quite intense, even though it's one muscle. So we looked at sleeping, guys. If you just tuned in with us, make sure you're sleeping where your spine is staying aligned. If your head's up high or too low, if you're sleeping on your stomach, that is not good, guys. So we looked at the stretch, we looked at trigger points, we looked at wry neck, we looked at the insertion. There's other here. We looked at other areas, how it can affect other areas in the body. Whiplash, we can look at here. Commonly seen when the head goes forward and backwards, so many people, we need to spend let's see, many ENTs don't accept that dizziness. Sherry, you're 100% right. She's saying that many ENTs don't accept that dizziness can come from the SCM. And I can tell you that it does. All right? I can promise you it does in many cases, because I've had so many, including myself, I've had so many issues I've seen in our office over the years, not only in our office, but I can tell you from the readings, from the research, that just a therapist getting in there and working the SCM, dizziness goes away. So yes, you can have vertigo, be an antivert, be on all these different kinds of medications, and you're just killing your inside of your body. You're just covering up those symptoms. And I'm telling you guys, the reason why I'm bringing this out to you and the reason why I'm exposing the world out there, because SCM problems can cause lots of these symptoms. I'm telling you, they can cause it. I've seen it. I've experienced it myself, and I see it over and over and over again. The young, the middle, the old, it can help. Just want to let you know. Hello, Catherine from Malaysia. Okay, so now why am I looking at that whiplash? Because many people are talking about reversal of the curve. You see, we talk about neck pain, and we're supposed to have a normal C-shaped curve in that cervical spine. It goes inwards like this, okay? So in other words, you get hit from behind, or you hit something from behind, your head goes forward like this, it gets into a whiplash, you stretch these ligaments back in here, and now your curve's reversed. So now you start experiencing problems with the discs, you start experiencing problems with the SCM muscles, and those SCM muscles are splinted now, they're shortening. Well, now, I'm going to spend a whole program on whiplash and reversal of the cervical curve and kyphosis or military neck, because I know a lot of people out there who are, you guys right now tuning in worldwide, have been to doctors, chiropractors, orthopedists, medical doctors. They said, well, you lost your curve in your neck. Well, I don't want you to panic, but the key thing is I talk about forward head posture, and the head weighs 12 pounds. For every inch we go forward, it's an additional 10 pounds. So 1 inch is 22 pounds, 2 inches, 32 pounds, 3 inches, 42 pounds. Guys, you cannot keep your head in this position. You need to jut the chin down. You need to start doing chin tucks. Okay, do those throughout the day. Strengthen those rhomboids between the shoulder blades. Okay, stretch those chest muscles. Get inside a door. You need to stretch those chests because these chest muscles are pulling you forward. But you know what? When your head goes forward, guys, your SCMs start to contract. I gotta find this picture, if I could find this great picture for you. So that's really important, guys. Very, very important. We look at this, the whiplash here. You can see you could tear ligaments, you could stretch ligaments. This is very common, and these things happen to all of us. A lot of times we can't prevent these kind of things. These whiplash injuries can, they beat you up. They beat you up. Now we look at this forward head posture. This forward head posture causes problems. All right? Obviously it puts stress, but what it's actually doing is making those SCMs work harder. So when you're in forward posture, it's difficulty to breathe the way you should, difficulty to really do a lot of things. But, we look at like the headaches, the common headaches, the torticollis. We look at the vertigo, the motion sickness, the dizziness, are all coming from these contracted forward head posture, these contracted, these muscles. Because when these muscles contract, I want you to understand one thing, that when your muscles go forward, the digastric muscles underneath, you can see me here, these muscles underneath here start to contract to try to compromise and compensate from these muscles here. And what happens is it starts affecting our jaw, our mandible, the muscles of the mandible start becoming affected, and it affects our TMJ. Aha! Forward head posture affects TMJ. And generally, when our head is forward, these SCMs are shortened. They're contracted. They're tight. So these muscles right underneath here, I'm not going to mention all the these fancy muscles, but the digastric muscles and other muscles, all the hypoglossal, all around in here, okay, these muscles start to contract and affects the mandible and affects the jaw and affects your bite. How many people ever had a whiplash or notice that their posture is bad and they notice all of a sudden their bite is off? That's because your mandible is off, because the muscles are off. It's affecting your TMJ. Even if you don't have pain in the jaw, it's affecting your jaw because of your forward head posture, because of these muscles that are contracted. You got to be very, very aware of that. So what do? You go to the dentist. The dentist makes you a mold for your teeth. Bruxism, that's correct. Thank you, FR3 Styler. They make you something, a bite plate, and it's not coming from your teeth. It's coming from your SCMs and your forward head posture. So I'm going to save you guys a lot of money, a lot of hell, and a lot of problems if you start becoming more aware of that forward head posture and those tight SCM muscles, because this can affect everything. That's why I'm showing you how this can affect here. It can affect behind in here. It can cause headaches. It can affect your vision. It can affect your hearing. It can affect your station too. Affect your balance. It could affect your neck, your shoulders, in between your shoulder blades. The body's very complex. The body's like a machine. The problem is doctors don't know how to operate this machine. They know how to operate pills. They know how to operate anti-inflammatories and all those other funky things that cause chemical effects in your body, but they're experimenting on you because they give you something. You go back to the doctor. The doctor says, well, okay, let's try this. Let me tell you something. It's bullshit. Excuse my language. I've been to doctors. I know what it's like. I've been on antibiotics. Something doesn't work. Okay, let's try these antibiotics. This doesn't work. Let's try this antibiotic. Okay, this is making you dizzy. Okay, we'll give you this. You guys, you need to be very careful. I'm telling you. I live it. I see it. Okay, I've been through it. I'm no different than you guys. We all have our little issues, our problems, but we need to resolve it. We need to do it the right way. The less we complicate our body, the body's going to stay healthier longer. I promise you. Okay, so take that for what it's worth. Okay, so that is the forward head posture, and we talk about the dangers of forward head posture. And we talked about this last week, and I want to share this, guys, before we make way and head out. I really appreciate all you guys tuning in worldwide and all your love and your comments. And I really appreciate you being here with us. You guys are just really good people. You're so proactive. I love you all. You're really proactive, and I really hope that the big man up there really looks at you, that you're doing something good for yourself. And if you are one of those kind of people who are suffering every day and having these chronic problems, of these headaches or back problems or herniated discs, that you are going to get through with it because you're proactive, you're learning, and you're going to take every door and open up every door you can till you find the right way to get well. And that's what you got to do. You got to find the right way to get well. And unfortunately, you cannot go to doctors because doctors just like to sit in their office and see one patient after the other, after the other, after the other. They've seen 50, 60, 70 patients within a short period of time. Your problems need to take time. And unfortunately, these doctors aren't giving it to you. So you need to take the time like you're doing right now, in all respect, and many blessings to all you. You guys are doing the right thing. Listen to me. You're doing the right thing, and you're going to get through it. I promise you. All of you are going to get through it. Because nothing lasts forever, pain don't last forever, and your body will build a tolerance, and things will change, and things will heal, so you need to be patient. Listen to me. Be patient. And while I'm on that topic, guys, there's a lot of you, I got a lot of emails that are talking about surgery. The doctor wants to do an epidural. The doctor wants to do this. Listen to me. If you're not having atrophy, loss of muscle, you're not having loss of reflexes, and you're not having significant loss of strength, you may be having pain, sit it out as long as you can, guys. Ice it. Get on some natural anti-inflammatories, a quercetin, to turmeric, to ginger. Stay on these types of things, bromelains. If you got to take some anti-inflammatories, non-steroidals, tentatively for a short period of time, it's not going to kill you if you take it with food. But you need to stick it out. You really need to hang in there and let your body do what it's got to do. Let's go to this picture before we end up. Dangers of forward head posture. The point I want to show you is that we talked about last time about pronated feet. if you weren't here, we talked about pronation of the feet, where the feet come in. And as a result of that, we're wearing the outside of our heels more than the inside. When we're pronated, the inside of the knee starts to rotate inwards. The hip rotates inwards. We start developing forward pelvic tilt. And what happens is that leads to an increased lordosis. Okay, let's look here. You get increased lordosis. You get kyphosis here, a hunchback in the upper back, and we start getting forward head posture here. So all I'm telling you guys is that you need to be aware that when you have a forward rotated pelvis, or you are pronated, or you're wearing your shoes incorrectly, you're developing knee pain or ankle pain or hip pain, just watch and be careful, because you need to really be aware how the body compensates. When one area becomes off, even if you get forward head posture, the body will compensate downwards. Forward head posture will make the back, we'll make our back hump like this. As this humps, the lower back becomes more hyperlordotic, becomes increased curved, and then we start developing anterior pelvic tilt. So the body is always compensating. I want you to understand that. That is just not correcting one thing and leaving everything alone. And that's why we're talking about this particular thing of the SCM here. This SCM really is something serious, and it is something that I will tell people out there that you really, really need to be aware of this particular type of syndrome. And I'm telling you guys that people don't talk about this, but this is that important that I know it's going to help you. All right? So anyways, I just want to wish blessings to all of you guys. I know it's about almost midnight my time out here. But listen, I enjoy coming out here. Guys, Omu, FR3, Janine, Tim, Sadish, 01, World Guy, all you guys here. Let me just say hello to Anthony, Pura, Jessica Wildflower, Wesley Wilson, Susan, Sherry, Melissa, someone, R. Mary, Jason, Sherry, Sumit, Ocho, and all you beautiful people out there. I appreciate you being in the chat room with us here tonight. And leave your, by the way, the best way when people ask questions, Motivational Doc is my Facebook fan page. I have an emails, all right, but I get about 300, 400, sometimes 500 emails in a day. And selected people like you, I just tell you that Motivational Doc is my fan page, and that's the easiest way. Usually I'll return my messages. I try to go through those because my emails are like this long. They just keep getting bigger and bigger and bigger. And I just, try to do my best. But anyways, guys, leave your messages and let me know if there's a specific topic that's interesting. I'll be more than happy to try to do my research, come out and talk about that topic live with you guys. I ask you to subscribe, share these videos with everyone you like, put them on your media out there, your social media, and just educate people. This, by the way, if you just tuned in here, this video will be posted in the next hour or so on my channel, as Facebook will put it on there. Guys, I just want to say blessings and thank you very much. I really appreciate your love. And again, I appreciate people like you because you're proactive. I'm proactive. And keep up the great work, guys. Okay? Much love to you.